Hi, my name is Tayo Busari. I'm a nursing student at the University of Manitoba. I'm here to make a video about safe medication administration technique and hygiene. My scenario is date March 10, 2020. The time is 7:50 a.m. Nursing Jake, phone number 312-312-654-654-987-987. According to the mark sheet, I have 2 transcriber signature here, so I can go ahead with my order. Docosahexaene sodium, suspension, 60 mg, PO, BID is due for 8 a.m. My scenario time says 7:50 a.m. so I can legally give it, and I've confirmed one has given it today, March 10, 2020. Latanoprost is an eye drop, 0.005%, 0.005%. 2 drops to the right eye, daily at HS is due for 2200. I'm not going to be giving this medication because my scenario time says 7:50 a.m. The next one is levofloxacin 500 mg, PO, daily is due for 8 a.m. My scenario time says 7:50 a.m. so I'm going to be preparing this medication. I've confirmed one has given it today, March 10, 2020. And the final one is Ramipru 10 mg, PO, daily is due for 8 a.m. and my scenario time says 7:50 a.m. so I'm going to be preparing this medication, and I've confirmed one has given it today, March 10, 2020. So now I'm just going to put my doctor's order hat aside, and I'm going to be bringing out my medication. The first one is Docosahexaene sodium. Docless and Docosahexaene sodium is the same thing. I've confirmed that using my drug card, and the doctor wants 60 mg. The medication comes in 10 mg per ml, so I can take a reasonable amount from here. The next one is latanoprost. I'm not going to be preparing this right now because it's due for 2200, and my scenario time says 7:50 a.m. The next one is levofloxacin. The doctor wants 500 mg. The medication comes in 250 mg per tablet, so I can take a reasonable amount from here. I'll just be needing 2 tablets. The next one is Ramipru. Haltex and Ramipru is the same thing. I've confirmed that using my drug card. The doctor wants 10 mg. The medication comes in 10 mg per tablet, so I just need 1 tablet. I've checked all my medication and none of them are expired yet. According to the mark sheet, my patient has no known allergy. That's what NKA means, but I'm still going to confirm that at the bedside table. Before I prepare my medication, I'm just going to be doing my hand hygiene. I'm going to be starting with the Docosahexaene sodium. Just going to bring container out. I'll take my oral syringe. I'm going to be shaking this suspension because it's an oral suspension. The doctor wants 60 mg. The medication comes in 10 mg per ml, so I'm supposed to be my calculation now. I know I need 6 ml, so I'm going to be taking 6 ml. Okay. I'm just going to be doing hand hygiene because I have some medication on my hand. I have 6 ml here. So now I'm just going to be covering this. This is my med rest. Just going to put this beside. I'm going to be doing my documentation, my labeling. So NJ is the same thing as Nursing Jack. The name of the medication is Docosahexaene sodium. The dosage is 60 mg. The volume is 6 ml. The concentration is 10 mg per ml. Confirm that using my medication container. Date is March 10, 2020. My time is 7:30 a.m. My signature is TBUMSN2. So I'm just going to put that aside. The next one is the latanoprost. I'm not making this because it's due for 2200 and my scenario time says 7:50 a.m. The next one is my levofloxacin. The doctor wants 500 mg. The medication comes in 250 mg per tablet. So I'm supposed to take 2 tablets. So now I'm just going to be doing my labeling. NJ is the same thing as Nucinjec. Levofloxacin, that's the name of the medication. The doctor wants 500 mg. The volume is 2 tablets. The concentration is 250 mg per tablet. The date is March 10, 2020. The time right now is 7:31 a.m. My signature is TBUMSN2. So I'm just going to be putting it on the side. The final one is the Ramipril. All tests and Ramipril is the same thing. I've confirmed that using my drug card. The doctor wants 10 mg. The medication comes in 10 mg per tablet. So I'm supposed to take 1 tablet. I'm just going to be doing my labeling. NJ is the same thing as Nucinjec. The drug name is Ramipril. The dosage is 10 mg. The volume is 1 tablet. The concentration is 10 mg per tablet. My date is March 10, 2020. My time right now is 7:35 a.m. Signature is TBUMSN2. So I'm just going to put that aside. Now I'm going to go ahead and do my second check. I'm going to be starting with my Ducosate sodium. Nucinjec. NJ is the same thing as Nucinjec. Ducosate sodium. Docless is the same thing as Ducosate sodium. I confirmed that using my drug card. Says suspension. This is an oral suspension. 60 mg. The medication comes in 10 mg per ml. So for me to get 60 mg, I need 6 ml, and I have 6 ml here. And I have 6 ml there. Yes. Here. Okay. Says PO, which means already is another medication. BID is due for 8 a.m. It's currently 7:40 a.m. So I can legally give it a confirmed one. I've given it today, March 10, 2020. I'm just gonna return this and put this. The next one is the latanoprost. I didn't make this because it's not due until 2200 and my scenario time says 7:50 a.m. The next one is the levofloxacin. Nucinjec is the same thing as NJ. Levofloxacin. This is levofloxacin. The doctor wants 500 mg. The medication comes, the doctor wants 500 mg, 500 mg. The medication comes 250 mg per tablet, 250 mg per tablet. Supposed to have 2 tablets to make 500 mg, 2 tablets, and I have 2 tablets here. It says PO, which means oral is another medication. Daily is due for 8 a.m. It's currently 7:45 a.m. I can legally give it, and I've confirmed when I've given today, March 10, 2020. I'm going to return this. Nursing Jake is the same thing as NJ. Ramipril. All tests is the same thing as Ramipril. I've confirmed that using my job card. The doctor wants 10 mg. The medication comes in 10 mg per tablet. 10 mg per tablet. The doctor wants 10 mg, 10 mg. The medication comes 10 mg per tablet. It says 10 mg per tablet here. Supposed to have 1 tablet, and I have 1 tablet here. It says PO, which means orally. This is another medication. Daily is due for 8 o'clock. It's currently 7:45. I can legally give it, and I've confirmed when I've given today, March 10, 2020. So now I'm just going to be taking my cup of water, and I'm going to be taking my pen to sign my mark sheet, and I'm also going to be taking my mark sheet to the patient's room. I'm doing my hand hygiene, safety check done. There's no tripping outside on the floor. Cord bell at reach. Patient's bed is at the lowest position. So, hi, my name is Taiwo Busari. I'm going to be your nursing. My name is Taiwo Busari. I'm going to be your student nurse for today. I'm here to come and give you your medication. Before I continue, I'm just going to confirm that I'm in the right patient room. If you don't mind, I'm just going to be checking your handband. Nursing Jake. Fin number 312-654-654-98797. Okay. Please, can you tell me your name, please? Nursing Jake. Okay, Nursing Jake. Okay. Can you tell me your date of birth, please? Okay, January 1, 1960. Okay, thank you very much. Do you have any allergy that you know of? Okay, you don't have any allergy. According to the mark sheet, you don't allergic to anything. Before I give you the medication, I'm just gonna do my third check. Okay, thank you very much. I'm going to start with my Ducosate sodium. Nursing Jake. Ducosate sodium. I have Ducosate sodium right here. It says suspension. This is an oral suspension. The doctor wants 60 mg. The medication comes in 10 mg per ml. I'm supposed to have 6 ml, and I have 6 ml here. PO, which means oral is another medication. BID is due for 8 o'clock. It's currently 7:45 a.m. I can legally give it, and I've confirmed when I was given today, March 10, 2020. Latanoprost, I didn't prepare this medication because it's not due on the 2200, and my scenario time says 7:50 a.m. The next one is the levofloxacin. Nursing Jake. Levofloxacin. I have levofloxacin here. The doctor wants 500 mg. The medication 500 mg. The medication comes 250 mg per tablet. So I'm supposed to have 2 tablets here, and I have 2 tablets here. It says PO, which means oral is another medication. Daily is due for 8 o'clock. It's currently 7:45. I can legally give it, and I've confirmed when I was given today, March 10, 2020. Nursing Jake. Ramipril. The doctor wants 10 mg. The medication comes 10 mg per tablet. I'm supposed to have 1 tablet, and I have 1 tablet here. It says PO, which means oral is another medication. Daily is due for 8 o'clock. It's currently 7:45. I can give it. I have confirmed when I'm giving it today, March 10, 2020. So now I'm done with my third check, and I'm going to be putting my patient at a Fowler position for me to be able to administer the medication. Okay, now my patient is at a Fowler position. Nursing Jake, I'm going to be starting with your Ducosate sodium. Nursing Jake, your Ducosate sodium is a lactative for your constipation. As long as I've checked your blood pressure and bowel sounds before giving you this medication. The side effects you can have is loose stool and nausea. If you feel any of this, please let me know. I will advise you to increase your mobility and also increase your exercise. before I give you this medication, I would like to ask you if you had any bowel movement today. No? Okay, that means I can legally give you the medication. Okay. Should I go ahead to give you this medication? Yes. Okay. Do you want it by the syringe or by the cup? By the syringe. Okay. Thank you. This is the water. Have you swallowed this? Yes. Okay, thank you very much. The next one I'm going to be giving you is the levofloxacin. Nucin-Jake, your levofloxacin is an antibiotic for your urinary tract infection. I assume that I've checked your blood pressure and also your temperature before giving you this medication. The side effect you can have is headache and dizziness. If you feel any of this, please let me know. It's okay if you've not eaten. It's okay. You can take it on an empty stomach. I'll advise you to keep yourself hydrated because of the antibiotics. I also advise you not to change your position rapidly because of the dizziness and for the side effects, which is headache and dizziness. If you feel any of this, please let me know. Should I go ahead to give you the medication? Okay. This is the water. You swallowed it, okay? And the final one I'm going to be giving you is Nucin-Jake. I'm going to be giving you your Ramipril. Your Ramipril is an antihypertensive medication for your high blood pressure. I assume I'll check your blood pressure before giving you this medication and your apical pulse. The side effect you can have is headache and dizziness. If you feel any of this, please let me know. Because of the dizziness, I'll advise you not to change your position rapidly. Should I go ahead to give the medication? Yes. Okay, thank you very much. This is the water. This is medication. And then this is the water. Have you swallowed it? Okay, thank you very much. So now I'm just going to be signing my mark sheet. 0750 TB UMSN2 0750 TB UMSN2 0750 TB UMSN2. So now I'm going to be putting I'm just going to be putting my patient at the lowest position, but I'm still going to leave my patient at the Fowler position because the medication has to go down for at least 30 minutes. Nucin-Jake, I'm sorry, I have to still leave you at the Fowler position because the medication has to go down. So after 30 minutes, I will come and put you back at your regular position. So like I said earlier on, any of the side effects I mentioned to you, if you feel any of them, please make use of your call bell and I'll be with you immediately. Safety check done. Call bell at reach. Patient is at the lowest position. My patient is not at distress. There's not any tripping aside on the floor. Okay, thank you very much. So I'm just going to be coming back every 30 minutes to come and assess my patient. And thank you. Bye.